For this last section, we're going to talk lung histology, and then we're going to talk about some lung pathologies. So this is what lung tissue looks like on a microscope slide. And you can see really clearly we've got the respiratory bronchiole here, this big space with a thicker wall. We've got the alveolar duct here, and then these little pockets coming off of that are the alveoli. Now, none of them got cut exactly correctly, so we can't see, the complete one, but remember they've got a hole in them so the air can enter and leave. We also have blood vessels running through. Here you can see these have really distinct looking walls. Those are our capillaries running around and through our alveoli. Over here we've got a scanning electron micrograph, so you can really see these distinct tissues. You can see how much of the lung is just air. Now this slide here, this microscope slide, this will be on the test, maybe not this exact one, but I do expect you to be able to recognize lung tissue on an exam. It's mostly air. Sometimes people get it confused with adipose tissue, which I can kind of see. But notice that here we see lots and lots of nuclei around each of these circles. This obviously isn't an adipocyte. Remember, an adipocyte is a single cell that's round. And when we look at adipose tissue, we see lots of distinct cells next to each other. This is mostly air. And then we've got these areas of rings of simple squamous cells making up all the various structures, the alveoli and the capillaries. So keep that in mind. Do make sure you can identify that on a test. That's what the lung histology, the lung tissue looks like. Now when we look at it at a diagram at even higher focus, we see the pulmonary capillaries running around the corners of the alveoli, and then we see that there are two types of cells that make up the alveoli. The type 1 cells are these big, wide, flat cells that actually do the gas diffusion. Notice there are these little spaces, little holes, pores between the different alveoli within the alveolar sac. The other type of cells are the type 2 cells. Those are these funky looking things right here. And these have a really, really important role to play. They secrete surfactant. Surfactant is a material that reduces surface tension in water, in any kind of fluid, but particularly in water. And this is really, really important in the alveoli. So first I want you to think back to the pleura again. Remember that the pleural cavity is only held together, the two layers of the pleura are only held together by the surface tension in the water molecules, because water molecules like to stick together. So if there's a really thin layer of water, those water molecules will stick together and stick the thing they're stuck to together. Well, we really don't want that to happen inside the alveoli. They can't stick to, the walls of the alveoli can't stick together, because then we couldn't breathe, we couldn't do gas diffusion. We need this little pocket to stay open so that it can fill with air so that gas can get in here and then diffuse into and out of the bloodstream. But also remember that this has to be covered in water, because air has to dissolve in water in order to get into the blood plasma. So this is lined in fluid. Yes, your lungs are actually lined in fluid. Not too much fluid, then you'll drown. Then you can't do gas diffusion because the air has to go through too much fluid. But there's a really thin layer of fluid on these cells. But if it's just water with particles dissolved in it, then the walls are going to stick together, because remember, they're 0.5 millimeter across. And so the surfactant breaks up the attraction between the water molecules and prevents the walls of the alveoli from sticking together. So if you have sufficient surfactant, then these walls don't stick together, because the water molecules aren't sitting next to each other and having that cohesion between them. Now, if you don't make surfactant, actually, you're never going to manage to get born, probably. Actually, I don't know if it does cause a miscarriage. I should look that up. But you're definitely not going to survive very long, because if you don't make enough surfactant, then these alveoli are going to fall closed. The walls are going to stick together. You're not going to be able to pull them apart enough to make every breath. So that's why those type 2 cells are really, really important. Then we have one other thing I'm sure you noticed. We have macrophages. Remember, macrophages are cells that do phagocytosis. Macrophage means big eater. So these are going to be patrolling your lungs to engulf any particles that didn't get caught already, or any pathogens that might have made it down into the lungs. Hopefully everything got trapped in the mucus and got carried out of the lungs, but obviously not everything does. So the macrophages are going to consume foreign objects. If they can, they're going to break them down. If they can't, then they're going to cause an immune response to happen, which eventually is going to cause a plaque or a hard substance. And that's what happens if you breathe, oh gosh, not arsenic. That's not the thing I want. The stuff they use in ceiling tiles. What's it called? Okay, I'll come back to that. That stuff, the macrophages can't break it down. So the reason it damages your lungs is because it creates scar tissue from the immune response, with the macrophages not being able to break it down. Now this is a real close-up showing a cross-section through a type 1 cell and the wall of a capillary. And you can see the O2 is diffusing, the O2 here is diffusing into the blood cells to oxygenate the blood. CO2 is diffusing out. Okay? All right, now, things that can go wrong. If you get too much fluid built up in your alveoli, usually because of an immune response, you have pneumonia. This is what your lung is supposed to look like. It looks black because the tissue is mostly air, or the space is mostly air. It's so not dense that it doesn't show up on an X-ray. The pneumonia shows up as this cloudy or opaque section. That's a very severe pneumonia, restricted to one lung, interestingly enough. One of the reasons this happens is that an immune response opens up capillaries and brings more fluid to the site, which also brings more white blood cells to clean up damage and get rid of pathogens. And so this is actually part of the immune response, is the buildup of fluid in the lungs. It can unfortunately kill you. We can see this on a microscope slide. If we take a tissue sample, here's a nice healthy lung, and you can see this is at a lower magnification. Here is a little higher magnification, but you can see instead of these really thin walls around the alveoli, we can see much thicker walls with fluid between them and lots of white blood cells trying to fight off the pathogen that has invaded these lungs. So this is what normal lung tissue looks like. This is what infected pneumotic lung tissue looks like. Now, other things that can damage your lungs, if you smoke, you're going to build up deposits of tar in particular in the lungs. That's what makes this blackness in the lungs, is the tar. By the way, this is the heart, okay? It's not shown over here. There should be a heart there. Healthy lung tissue doesn't have these deposits, and you can see it's still mostly air. For someone who has smoked, then these deposits start building up. Most healthy lungs for people who live in cities actually don't look this pink. This is kind of freakishly pink. Human lungs for people who have lived in cities actually usually have little spots of black on them from all of the things we breathe because of like smog and car exhaust and dust and things like that. We very often have small deposits of black on our lungs. Smoking, you're just increasing the amount of particles that get into the lungs, and so you see these big black patches. The whole lung is gray, and that is the buildup of these particles. And as you can imagine, this makes it much harder to do gas exchange because literally the walls of the cells become thicker. There's more space because of all these deposits. There's more space for the gases to diffuse across. The other thing that smoking will do to your lungs eventually is that it will actually kill the type 1 cells. So here's what a healthy alveoli look like. Complete walls with just the pores. With smoking, the buildup of the tar and other toxins in the smoke leads to dying or damage of the alveoli, so that you have more holes in the walls of the alveoli and less surface area for gas exchange. So if someone has emphysema, which is a form of chronic obstructive pulmonary disease, they actually have too much space in their lungs and not enough alveoli, not enough type 1 cells. And so there isn't as much surface area for gas exchange. They can bring air into their lungs, but they can't get that oxygen into the bloodstream. So they have shortness of breath. One of the reasons they cough is because the body is trying to get the particles out of the lungs. So there's your lesson. Please don't smoke. Take care of your lungs. They're the only ones you've got. And that's the end of our respiratory lectures.